Self-care after birth, also known as postpartum care. Breastfeeding and care. Breast care. You want to use a supportive bra. Breast shells should be worn for flat or inverted nipples. Cracking and bleeding are from positioning the baby for feeding the wrong way. For breastfeeding, you want to position the baby like this picture on the right to help cracking or bleeding. Use one arm to support the baby. Use the other hand to bring the breast up to the baby's mouth.
For bottle feeding, make sure the bottles and caps are clean before use. Read the directions on the formula box and prepare the formula by following the directions. You can warm refrigerated formula if you'd like, but do not use a microwave. Set the bottle in warm or hot water for about 5 to 10 minutes before feeding. After the baby's done feeding, measure how much your baby drank and then burp your baby over your shoulder or on your lap by holding the baby upright and gently but firmly patting their back until the baby burps.
Uterus changes. Your uterus houses the baby and turns inwards after birth. It'll go back to your pre-pregnancy state. The uterus will contract in order to deliver the placenta. The uterine lining will thicken, which takes about 2 to 3 weeks, and the healing of the placental site takes about 6 to 7 weeks.
Lochia changes. Lochia is a vaginal discharge that occurs after birth and it consists of blood, decidua, and mucus. Lochia rubra is red in color, lasts about 4 days, consists of red blood cells, white blood cells, bacteria, and decidua material. Lochia serosa is pinkish or brownish in color, consists of red blood cells, white blood cells, mucus, and lasts from day 5 to day 11. Lochia alba is white or cream colored discharge consisting of white blood cells, epithelial cells, fat, cervical mucus, and bacteria. Is present from day 11 until week 3 postpartum but may persist for 6 weeks.
Bowel and bladder patterns. Constipation is when a person poops less than 3 times in a week. This can happen after you have your baby from hemorrhoids, pain, hormones, and medication taken during the birth. Tips to avoid constipation. You want to walk around after having your baby. You want to drink water regularly. Eat foods that decrease constipation and increase fiber, such as vegetables, wheat, beans, oats, and berries. A stool softener can be used. This is medicine used for easy pooping. Also, an enema can be used, which is an insertion of liquid into the anus to increase the occurrence of poop.
You can also expect to experience some emotional changes after you give birth. You may feel sad, lonely, or scared. If this happens, reach out to support groups and new mother groups. Make sure you get adequate rest and sleep often. Feeling sad after birth happens to a lot of mothers, and you should reach out for help for extreme sadness or other signs such as trouble sleeping at night, not being hungry, extreme frustration, difficulty bonding with your baby, guilt or loss of interest in your baby or other hobbies.
Support system and care. Your support system can include husband and wife, boyfriend, girlfriend, extended family, parents, and friends that may be actively involved in you and your baby's care after birth. Having support after your baby is born is important in your emotional and physical well-being of you and your baby. Having good support from friends and family can reduce the likelihood of extreme sadness after giving birth, also known as postpartum depression. Social support groups give new moms a chance to talk about their new experiences and feelings in a comfortable place. Women, Infant, and Children's, also known as WIC, is a supplemental nutrition program through the United States Department of Agriculture that provides food, health care, and nutrition education for women and their children up to 5 years old. To see if you qualify for this program in the state of Ohio, call toll-free at 1-800-755-4769.
For nutrition requirements, it is recommended that you have about 1,000 milligrams per day of calcium, 15 milligrams per day of iron. For fluid intake, make sure you drink enough to satisfy thirst and prevent constipation. It is okay to have small amounts of alcohol and moderate caffeine, but if you're going to drink alcohol, drink after breastfeeding to get the alcohol timed out of your system before the next feeding.
Dietary recommendations. Foods high in calcium include milk products like low-fat yogurt, skim milk, buttermilk, and skim mozzarella cheese or cheddar cheese. Fishes like sardines, salmon in a can, ocean perch, or canned clams. Don't eat swordfish, shark, king mackerel, and tilefish. Eat greens like spinach, turnip greens, kale, and beets. Other good foods include tofu, waffle or pancake mixed with milk and egg, an English muffin. Eat a lot of fruits and vegetables, whole grains and proteins like meat, fish, and soy, and get a lot of vitamin C.
Exercise. Exercise after birth helps strengthen the stomach, increase energy, prevent extreme sadness, and promote better sleep. You should do at least 2 hours and 30 minutes of exercise each week, but start with easy exercises such as walking or riding a bicycle, and then slowly moving to running, swimming, or jumping rope later on. You can do some yoga, sit-ups, or push-ups about 2 days a week to get stronger muscles. You can also do Kegel exercises, which are regular squeezing and letting go of the vaginal muscles to help make them stronger. Even 10 minutes of exercise is okay, but make sure you stop if you feel pain or if you feel tired. You can start exercising as soon after the baby is born as you want, but you could also do a couple days after when you feel ready. If you do not have a gym that you go to or a way to exercise, walking outside or dancing are good and easy ways to try. If you had a C-section delivery, you should wait until you are completely healed and free of pain to start exercising, or ask a doctor or a nurse.
Episiotomy or surgical incision care. An episiotomy is a minor incision made during childbirth to widen the opening of the vagina. To relieve pain or discomfort, ask a nurse to apply ice packs right after birth. Take warm bath. Ibuprofen may be used, such as Motrin and Advil. You want to change your pads every 2 to 4 hours. Keep the area around the stitches clean and dry. Spray warm water over private area and pat with clean towel or baby wipe. Do not use toilet paper. Wait at least 6 weeks before you use tampons, have sex, or do any activities that may break the stitches. If you had a C-section, you want to take it easy. Rest when possible, keep important things within reach, and do not lift anything heavier than your baby for a few weeks. You want to support your abdomen. Stand and sit up straight. Place hand over incision when coughing, sneezing, or laughing. To seek pain and relief, you can use things such as heating pads, Motrin, Tylenol, or Advil. And you want to drink plenty of fluids. This helps prevent constipation and will replace fluid loss during delivery.
Private part care and pain. Wash hands before and after changing pads. Do not wipe but pat from front to back after using the bathroom. You can use an ice pack or a sitz bath. A sitz bath is sitting in a bowl of warm water to decrease pain. Stay in the sitz bath for about 20 minutes and pat yourself dry. You can also do a cool sitz bath to reduce swelling. For a cool sitz bath, start with a bowl of tap water and add ice so the temperature is comfortable.
Hemorrhoid care. Hemorrhoids are swollen and inflamed veins in the anus that can cause pain, bleeding, and itching when pooping or sitting. Things to put on top of the sores can be creams, hazel pads, or ointments that are available at drugstores or the pharmacy. Increase the amount of water you drink during the day and eat foods such as veggies, wheat, beans, and berries. Try a sitz bath and lay on your side while sleeping to ease the pain. Thank you for watching, and congratulations on your new baby.